Hey everyone, welcome back. I'm sure you're all crazy busy keeping up with everything going on in healthcare.
Oh, yeah.
So, we thought we'd jump right into it. Let's tackle something that I think we're all seeing more and more in our practices.
Definitely.
Which is MAFLD. That's metabolic dysfunction-associated fatty liver disease. And it can be a real challenge to effectively diagnose it and then, once you've diagnosed it, manage it.
Absolutely.
Thankfully, there's some really exciting tools
for sure.
that are helping us out. That's actually what we're going to talk about today.
Yeah.
We're going to explore the latest in non-invasive testing for MAFLD. This is based on a recent article from the World Journal of Gastroenterology.
Okay.
It's called Recent Developments in Non-Invasive Methods for Assessing Metabolic Dysfunction-Associated Fatty Liver Disease.
Catchy.
It's written by Singh, Swahal, and Betta.
Okay.
And it was published just last month on October 21st, 2024.
Wow, so it's really cutting edge.
It is. So, as you know, the gold standard for diagnosing advanced fibrosis in MAFLD has always been liver biopsy.
Right.
But
It has its limitations.
Yeah.
It's invasive.
It is, and it's not always practical.
Exactly. And there are risks, obviously, being an invasive procedure.
Yeah. Not to mention, sometimes there are sampling errors.
Definitely.
So it's not like you can do it all the time on everyone.
Right.
So then where do we even begin? What's the first thing that we should do? What's our first line of defense?
Well, a great place to start is the Fibrosis 4 Index, or we call it FIB-4 for short.
Okay, FIB-4.
And it's actually recommended by the American Association for the Study of Liver Diseases, the AASLD,
Okay.
as a first-line test for liver fibrosis screening.
Nice. Easy to remember.
It is, and
Yeah.
the beauty of it is it's a really simple calculation using lab values that you're probably already getting.
Oh, okay.
So we're talking age, AST, ALT, and platelet count.
So you're saying, like, a regular blood test can give us a good idea of whether the patient's at risk for fibrosis.
Yeah, you're on the right track. When the FIB-4 score is low, it has a high negative predictive value.
What does that mean?
It means you can be fairly confident ruling out advanced fibrosis.
Oh, wow.
Yeah. And there was some research done. A study by Siddiqui and his colleagues actually showed that FIB-4 is better than other scores.
Really?
Yeah, in detecting both moderate and advanced fibrosis. And this is even true in lean patients who, as you know, tend to have worse outcomes.
Right. So this is something we can use pretty confidently in our practice
Definitely.
to rule out advanced fibrosis
Yeah.
for a lot of different patients.
Exactly. And that can really help guide your decision making.
That's so helpful. But I'm guessing there are some limitations.
Of course. It's not a perfect predictor, right? It's
Right.
less accurate for patients younger than 35.
Okay.
And as patients get older, especially over 65, the specificity for advanced fibrosis decreases.
So age is a factor.
It is. And of course, certain medications, or if a patient drinks a lot of alcohol, things like that,
Oh, right.
can affect the platelet count or the AST levels.
Interesting.
So those things can potentially make the FIB-4 score less reliable.
Got it.
So it's not just about the numbers, right? You have to look at the whole picture.
That makes sense.
You have to consider the patient's age, their medical history, their lifestyle, all of that.
Okay. So it's a great starting point,
Definitely.
but we can't rely on it blindly.
Exactly. You have to use your clinical judgment.
Right. So let's say the FIB-4 score comes back high, or we just need more information.
Yeah.
What other non-invasive tests are out there?
Well, there are a few other scores that you might consider. There's the APRI score, the Fatty Liver Index, BRR, and the Fornes Index. They all use different combinations of lab results.
Okay.
But like FIB-4, they can be affected by other factors.
So these blood test scores can be useful
Yeah.
for initial screening, for sure.
Definitely.
But we have to be mindful of their limitations.
Absolutely.
Okay, so what about imaging? Are there any non-invasive imaging techniques that we can use to assess liver fibrosis?
There are. And this is where elastography comes in. It's kind of like when you press on a loaf of bread to see how fresh it is.
Oh, interesting.
We're basically measuring liver stiffness.
Okay.
Using specialized ultrasound or MRI techniques.
Yeah.
The stiffer the liver, the more advanced the fibrosis is.
So it's a way to actually see the changes that are happening in the liver.
Yeah, exactly. To visualize those structural changes.
That's pretty cool. So what are the different types of elastography?
Well, the two main types are VCTE, which uses ultrasound, and MRE, which uses MRI.
Okay.
VCTE stands for Vibration-Controlled Transient Elastography.
Got it.
It's more widely available and less expensive.
That's good.
It is, but it can be affected by things like obesity or inflammation.
Oh, okay.
MRE, on the other hand, is considered the gold standard for accuracy.
MRE. What does that stand for again?
Magnetic resonance elastography.
Okay, so it uses MRI.
Right, and studies have shown it has an AUROC, which is the area under the receiver operating characteristic curve, of over 90% for detecting significant fibrosis.
Wow, so it's very accurate.
It is, but of course, access can be an issue.
I was going to say, if it uses MRI, it's probably not as widely available.
Yeah, you're right. It's not as available as VCTE because it's more expensive.
Right.
And requires specialized equipment.
That makes sense. But it sounds like if you have a patient with a high FIB-4 score or other risk factors, and you really need to know for sure how bad the fibrosis is, it might be worth trying to get them an MRE.
Absolutely.
Okay. So we've talked about individual tests.
Right.
But the article also talks about combining different biomarkers.
Yes, and that's a very promising area.
How so?
Because combining biomarkers can really improve the accuracy of our assessment.
Interesting.
One example is the Enhanced Liver Fibrosis Score, or ELF score for short.
ELF score, okay.
It uses 3 serum biomarkers: hyaluronic acid, procollagen III, N-terminal peptide, and tissue inhibitor of matrix metalloproteinase 1.
Wow, that's a mouthful.
It is. But it's been shown to be very effective at detecting advanced fibrosis.
That's good.
And research even suggests that it's as accurate as a liver biopsy.
Really?
Yeah, in predicting long-term liver-related outcomes.
That's pretty incredible. So it's like having this really specialized team working together to figure out who's at the highest risk.
Exactly. It's like a task force.
I like that analogy.
Good.
Are there other combination biomarkers out there that are showing promise?
There are. There's the FibroScan AST score, which combines VCTE results with AST levels.
Oh, okay.
And that one's particularly good at identifying patients with MASH.
MASH?
Yeah, that's metabolic dysfunction-associated steatohepatitis.
Oh, right.
And it's also good at detecting significant fibrosis. And then there are these newer scores, AGILE-3+ and AGILE-4, which combine VCTE with patient demographics and other serum biomarkers.
Wow, so they're getting even more sophisticated.
They are. And they have a lot of potential to be even more accurate.
That's amazing. It's incredible how much progress is being made.
It is. It's exciting.
It really feels like we're starting to get a handle on non-invasive testing for MALFD.
Yeah, we're making real strides.
You know, speaking of progress, the article mentions these 2 research projects, NIMBLE and Litmishase.
Oh, yeah, those were big.
Can you tell us a little bit about them?
Sure. These projects have really helped us understand how well these non-invasive test panels perform. NIMBLE stands for Non-Invasive Biomarkers of Metabolic Liver Disease.
Okay.
And they looked at several different biomarkers and found that the NIS-4 score was great for identifying patients at risk for MASH. And the ELF and Fibrometer VCTE were very accurate for detecting advanced fibrosis.
So now we have even better tools to identify who's at risk
Exactly.
and who already has significant fibrosis.
Yeah, which is crucial for early intervention and prevention.
Absolutely. That's a game changer.
It is.
Okay, so what about LITMUS? What was their focus?
Well, LITMUS, which stands for liver investigation, testing marker utility in steatohepatitis.
Okay.
It had a broader scope. They were looking at a lot more biomarkers.
Oh.
And while they didn't find one single biomarker that could replace a biopsy entirely,
I see.
several of them did stand out, like the Soma signal test, the ADA-PT score, and VCTE.
Okay.
All showed strong potential for pre-screening patients for clinical trials.
That's really important.
It is, especially as we move towards more personalized therapies.
Right. So these projects are basically helping to make clinical trials more efficient and effective.
Exactly. And that ultimately benefits our patients.
It's amazing how much progress has been made in just a few years.
It is.
But where do we go from here? What's next for non-invasive testing in MALFD?
That's a great question. And that's where things get really exciting. The future is in omics-based biomarkers.
Omics. That sounds pretty futuristic.
It is.
What does that even involve?
So omics is about analyzing these huge sets of biological data, things like genomics, proteomics, and metabolomics.
Wow.
Imagine being able to personalize treatments based on a patient's unique molecular profile.
That would be incredible.
It would. We're not there yet, but the potential is huge.
So omics is still in its early stages.
It is.
But it holds a lot of promise for personalized medicine.
Absolutely.
It's really an exciting time to be in healthcare with all this innovation happening.
It is.
But before we get too carried away talking about the future,
Right.
let's just recap what we've talked about so far.
Okay.
We started by talking about why liver biopsy isn't ideal for routine MALFD assessment.
Yeah, it has its downsides.
And then we went through all these different non-invasive tests,
We did.
starting with the FIB-4 score, which is a simple and effective tool for initial screening. And we talked about other blood test-based scores like APRI and the fatty liver index.
Right, and the importance of interpreting those results carefully.
Yeah, taking everything into account.
Exactly.
And then we moved on to imaging techniques, explaining how elastography, particularly MRE, can give us really valuable information about liver stiffness.
Yes, very valuable.
And then we talked about combination biomarkers, which are so exciting.
They are.
Like the ELF score and the FibroScan AST score.
Cool tools.
And of course, we talked about the Nimble and Litmus projects.
Which have really advanced our understanding of all of this.
They really have. It's a lot to take in, but it's so important for anyone working with MAFLD patients.
Absolutely.
And the field is moving so fast, it's crucial to stay updated.
You got it.
That brings us to a really important question for our listeners.
Yeah.
With all of these advancements, how do you see yourself incorporating these tools into your practice?
That's a good question.
How can you use this knowledge to make a real difference for your patients?
It's something we should all be thinking about.
Absolutely.
As we strive to provide the best possible care for people living with MAFLD.
It's a journey we're all on together, constantly learning and adapting as new tools and knowledge emerge.
Couldn't have said it better myself. It really highlights the fact that MAFLD care is becoming more personalized.
That's a great point. There's no one-size-fits-all approach, is there?
Not at all.
We really have to look at each patient individually.
Absolutely. You have to consider their risk factors, their lifestyle, their access to resources, all of that.
Absolutely. So clinical judgment is still so important.
Oh, it's paramount. We can't just plug numbers into a formula.
Right.
You have to consider the whole picture, the patient's history, the physical exam, everything.
It's about integrating those test results with the whole person. That's why we do what we do.
And that's what makes this field so exciting.
It's always evolving, challenging us to grow, to learn, to push the boundaries.
And to make a real difference in people's lives.
That's what it's all about, using this knowledge to help patients with MAFLD live healthier lives.
It's a privilege to be a part of it.
I agree. It's been so insightful talking to you today,
Likewise.
learning about all these advancements in non-invasive testing.
And thinking about the future of MAFLD care.
It's given me a lot to think about.
I hope so.
A huge thank you to all of our listeners for joining us on this exploration of non-invasive testing for MAFLD.
We appreciate you being here.
We hope you found this discussion informative, engaging,
And maybe even a little inspiring.
and remember, you can find all the information we talked about today in the show notes.
Including that article by Singh, Sohal, and Bhatta, Recent Developments in Non-Invasive Methods for Assessing Metabolic Dysfunction-Associated Fatty Liver Disease,
From the World Journal of Gastroenterology.
along with a complete bibliography.
Be sure to share this episode with your colleagues.
Spread the word.
Let's all keep learning, growing, and working together to improve the lives of people with MAFLD.
Absolutely.
Until next time, stay curious and keep learning. Disclaimer and bibliography in the description.